Welcome to ChiroSphere, where we talk about all things chiropractic and some things, well, not so chiropractic. I'm Dr. Ray Foxworth, your host for ChiroSphere and CEO of Chiro Health USA, the network that works for chiropractic. Pregnancy, postpartum, and early motherhood are often treated as phases to get through. But what if they were actually the foundation for lifelong health? Today's guest, Dr. Cristina Padilla, has built her career around that idea. A chiropractor, pediatric and prenatal specialist, birth fit coach, and current president of the Women's Chiropractic Organization, Dr. Padilla is the founder of Thrive Family Chiropractic, a house call practice designed to bring personalized, empowering care directly to families. Originally from Puerto Rico, she is driven by a passion for supporting women and children at every stage of their journey, while also advocating for greater mentorship and representation within the profession. Dr. Padilla, welcome to the show.
Thank you so much for having me, and thank you for the
Yeah,
introduction.
and I won't tell it. Yeah, and I won't tell everybody how many retakes I've had to do on this. I'm just
Nobody needs to
having a
know.
hard time getting. Yes, having a hard time getting words out. My editor's going to hate me today. So you started your journey in Puerto Rico and followed a path rooted in science. What
Yes.
initially drew you to chiropractic, and when did you realize you wanted to focus specifically on women and children?
So the path to primarily going into pediatric and perinatal care came from medical school. I from the beginning that was what I wanted to do. Was not raised in a chiropractic lifestyle, which is I know different for a lot of people. But didn't have my first adjustment until I was 16, and it wasn't for wellness care. There was no salutogenic model with it. It was, you have pain, we will fix it. If you still have pain, come back. And so it didn't have any lasting impression of me like a lot of stories you hear out there where, that adjustment changed my life. It got me better and I moved on with my life. And so my second encounter with chiropractic care came later on in life when I was in college, and medical school did not align anymore with what I wanted to do. It didn't align with my values, with where I was in life as a college graduate. And so it didn't seem to fit what I wanted to do to take care of kids and pregnant women. And so one of my really good friends, my best friend who passed about 5 years ago, was a professional athlete, and he was very impacted by his chiropractor, not just in the functional aspect of it as an athlete, but as a mentor. And he always said, you would make a great chiropractor and you would fit right into this profession. You should look into it. And so I did, and not really thinking that I would find my way into prenatal and pediatric care that way, because I did not know that this was an option. And so I went to chiropractic school in what's called now Northeast, so in New York Chiropractic College, and graduated. And during my second year, I attended Jeannie Ohm's Webster Technique course through the ICPA, and that was it. I was fully invested at that point. I was committed that this is what I wanted to do. And so from that point on, every decision I made in my education and moving forward was related to learning everything I could about pediatric and perinatal care.
Got it. So, just out of curiosity, because I've known people who've gone through this too, when they've gone down the path of medicine and then choose chiropractic, what was the family reaction, or was there?
There was a reaction. Coming from a Hispanic family, that was not very well taken, because it wasn't an immediate switch from, oh, I'm in medical school and I'm going to go to chiropractic school. There was a break in between. There were changes. There was a lot of unknowns in between, and so nobody in my family is a chiropractor. So it was a lot of new for all of us, and so I think long term, it has improved everybody's quality of life and vision of what healthcare is as well. So,
So, you built your practice around the idea that chiropractic and wellness should be part of a family's routine, not just something they have to do. Can you expand on that philosophy? How
absolutely.
do we get them to understand that?
Yeah, was just having this conversation with my associate just before I hopped on with you. We were talking about how to relay this message of the longevity of the value of care, of having chiropractic care be part of your life outside of something being wrong that we need to correct. And so that's a ludogenic model and that lifelong longevity wellness type of aspect. And so a big part of what we do here is we obviously, most of our patients come in like most chiropractic offices because there's something that needs to be corrected. There's some pain point, for lack of better words, that they want corrected or fixed in their baby, in their pregnancy, in their ability to conceive, in their postpartum period. And so, our role here is to shift the mindset into we're not only focusing on what your baby is suffering from right now, but we're also looking ahead at what this is going to look like if nothing is done in 6 months when they're trying to learn how to crawl. Are they going to be able to crawl because of the things that are presenting now? And then we're looking at, well, what happens in a year when they start to speak? Is this going to be affected? And we try to explain and try to incorporate how everything we do in the beginning, it's setting the pace and it's setting that baseline of wellness and success for those kids moving on. And so that is not easy to explain all the time. And it's hard sometimes for parents to see, but we see that a lot of them do come back later and they're like, you know what, I think we need to continue this because we're seeing those changes you were talking about and how it's affecting other aspects of life.
Over the years, it was interesting to watch patients, those that would come in, as I call it, when they crash and burn. They get treated a few times, and then you see them the next time they crash and burn. Well, that happens 3 or 4 times over the year, and, so I let them do it their way. That's what they wanted, that's what they asked for, so we deliver on that. But generally, after about the 3rd or 4th time, we sit down and have a little knee-to-knee conversation, say, "Listen, I appreciate the business, but the way you come in to see me on episodic care, you're gonna see me 6 or 8 times, 8 or 10 times, 5 or 6 times over the course of a year. Would you like to know if there's a better way that you can come see me less?" And really to get them to shift from, "Oh, you mean I can get treatment periodically and not have flare-ups, have them not last as long?" And sometimes it just takes them seeing that the crash and burn model is certainly a model, but, at least you've opened up the conversation for, there's a better way and you might wanna consider it, and then again, let them make the choice.
Exactly. Yes.
So how that your house call model is really a unique approach. How about fill us in on that and what inspired you to take chiropractic care out of the office and
Yeah.
into a patient's home?
Yeah, so obviously we're in my office now. So I we have both. Right now we do we call a hybrid practice where we do both house calls and in office. I'm in Jacksonville, Florida, so it is a little widespread and the convenience of house calls really changes access for a lot of patients and families. And so I started that right off the bat in 2017 when I opened my practice. I was working as an associate somewhere else and part time. And so I had the ability to do something else on the side to start building up my practice. And I wanted low overhead. I didn't want I didn't want an office. I didn't want staff. I didn't want any of that. I just wanted to practice by myself. And so it's funny how the universe has jokes. But I did that for about almost 4 years exclusively and it got very busy. It was just me going all over town with my portable table and my bag of equipment, and it was great. The word got out very quick in town, and I was able to provide a different experience for patients. It made it really easy for mothers to be able to continue care and to commit to care, because now that I'm a mom and I have a 16-month-old, I understand that postpartum haze where every choice is hard and you don't want to add on one more thing to do. So the convenience of coming to mothers during that early stages of pregnancy or late stages of pregnancy and early stages of motherhood is really key, really vital to give them the ability to continue to do the things that they know are important. They're just hard to do because it may just be you and you're managing a lot of different things, right? It also makes it accessible for mothers to take care of themselves too, not just their babies. So it was really fun. I enjoyed it. It was just physically a lot on my body. But it opened up a lot of different opportunities. I adjusted families in an RV. I adjusted families in by the pool during COVID times. I had patients that would set up a tent in their driveway during COVID so we could see everybody out there. Neighbors would walk by and be like, "What is going on?" Uh, so a lot of very interesting experiences for sure. In a farm, I have some great photos of me adjusting in the middle of a farm out like an hour away from where I live. So some great, great experiences that way.
You know, and again, in our practice, we didn't see a ton of kids, but the parents that would, the mothers particularly that would come in, especially if they had a toddler and they were pregnant with, with the second one on the way, that's a major event to get out of the
It
house and
is.
to
It
go
is.
some. I mean, it's
And make
not
it on
like, oh, I
time.
think I'll just go down to the chiropractor. It's like, I mean, the stars almost have to be aligned for that to come off
Oh, yes,
in
definitely.
a lot of cases. So, I mean, just a great model to be able to meet people where they are. I mean, that's certainly something I never thought of, but that they're, and let's face it, this day and time, I'm surprised there's not a DoorDash for chiropractic.
Right. Oh my goodness. Yes. That's
Everybody's used to getting everything at home now.
Yes,
It's
that's true.
crazy.
It's true. And I think on the doctor side too, it's a really good option for doctors that are starting to get their feet wet, to start their own thing, whether it's part time or full time with very low overhead. Most of us as students already have a table. We already have most of the equipment. It is less intimidating, I think, for a new graduate to take on something like this and start small and then go as big as they want to get. And that's a different model of practice, obviously, than what we're used to in the profession and in most of healthcare, right? Where the model used to be get an office, get staff, a lot of equipment, big spaces, but not all of us need all that space, right? So that has been very helpful. It's something I encourage a lot of people to do too, especially doctors that are trying to switch some into something where it's on their own. It's just a great option to do.
Yeah, when you think about the amount of overhead that you take on when you open a practice on top of student loan debt, it's like, "I'll never get out of this." And so I think it's actually healthy for the profession to have other delivery models, whether it's the corporate model, whether it's the home health,
Yes.
approach. Um, yeah, I think economics is a big driver in that as well, and I think we will see here delivered in other ways that we haven't even thought of yet,
I agree.
in
I
the
think
future.
so. Yeah. Between collaborative care, interdisciplinary, like you said, corporate wellness, it's a huge, huge draw and a huge need too for in multiple aspects. So I think it's really important with when it comes down to what it takes to run a practice and maintain it too, where it actually is successful and profitable.
So I understand you're a birth fit coach, and that involves integrated movement, mindset, and overall wellness into your work with mothers. So fill everybody in on what a birth fit coach is, because I don't know that I've heard that term.
Yes. BirthFit is the name of the program in the company. It was created by a chiropractor, a female chiropractor, Dr. Lindsay Matthews. She goes by a different last name now because she got married. But she is a practicing chiropractic as well in Texas. And so it is a program for chiropractors and other healthcare professionals that are in the fitness industry. So personal trainers, physical therapists, different providers, and it encompasses all aspects of health during the perinatal period, everything from nutrition to functional movement, intentional movement, chiropractic care, nervous system regulation, and how all of those aspects are affected by the nervous system being the core and primary purpose of what we're managing. And so it's a set, like I said, it roots on DNS or dynamic neurostability or functional movements with the idea that as adults, pregnant or not pregnant adults, we should be moving like babies do, right? And as we age, we lose a lot of those movements. But if we always talk about this, you watch a baby squat, and that is the perfect definition of a squat. Just the stages developmentally of rolling over, going into hands and knees, going into a seated position, a squat position, crawling, walking. That is how we should continue to move as adults in order to maintain longevity and health. It improves our health outcomes. It creates all aspects of life a little bit better. So integrate that into pregnancy, where the body is changing so much. We focus on those core movements during pregnancy so that postpartum recovery and birth are easier and better.
Well, everyone, if you would hang tight while we take a quick break to hear from our sponsors. Welcome back to our podcast with Dr. Cristina Padilla. So, you're a mom, a chiropractor, and now president of the Women Chiropractors Organization, I should say. How do you juggle all these roles without burning out?
That's a great question. Delegating is a great thing. Not something that came to me naturally. It's something that you learn for sure, but it takes a village. It quite literally takes a village. But I think a big part of it is finding things and doing things that resonate with who you are, that line up with your values. I love the organization. Women Chiropractors has been part of my life for over 5 years now in multiple ways. I've received mentorship as a new doctor. I've received mentorship as a doctor transitioning through careers before opening my practice during the tough times during COVID, and I wanted to continue to do that for others. And so I have been in every role possible within the organization, now as a board member and a president for the past 2 terms. This will be my last term as president and on the board. And so it's easy because it's what you love. I think that's the biggest thing. And a lot of people ask me that question, and so they're like, you have like 3 jobs. And I'm like, well, yeah, it's fun though. And it's opened a lot of doors and a lot of opportunities to be able to help the women coming up behind me, to be able to be a presence for other chiropractors locally, to be able to help women in many, many capacities. And so I think aligning with the things that you enjoy and you love, it's what makes it a lot easier to do.
I wish something like that had been around when my mom went into practice. She was a single mom, went to chiropractic college, took me and my sister to Indianapolis with her. And this was back whenever you could go to school at night. And so I jokingly tell people I started chiropractic college in 1965 and I graduated in 1985. I'm just a slow learner.
Yes,
But literally, I was in class with her every night
amazing.
while she was going through school. And then, years later, I go to school myself and get a real degree this time. Uh,
The perspective on that. So I that is a core memory I have. My dad did his masters in at night when he was working. He was in finances and he worked for a bank for 40 years. And I remember vividly going to night school with him some nights. And now looking back at what he was doing and me thinking about having to do something like that, it's a lot. It's overwhelming, and we had sports and we had school and we had all these different things. So props to our parents, because I guess there was no other way to do it back then. You had to do it.
yeah, yeah, and again, keep in mind that's late '60s, and there just were not a lot of women in chiropractic. Period.
I was going to say there's a
Then,
lot of yes, groundbreaking things that it takes a certain kind of woman to be able to say, this is what I'm going to do and I am going to do it.
yep, and she is my hero, my mentor, and I'm an unapologetic mama's boy.
I
Wish she
love
was
it.
still with us.
I love that.
So, what challenges did you personally face early in your career? Now that you're working to help others, what would you say are the most common challenges that women are facing when they first come out of school now?
The biggest thing looking back, I would say, was figuring out who I was as a provider, say where I fit in chiropractic, right? There was this idea when I graduated in 2014. And so the concept and the teaching and the idea was that you graduated and you work 60 to 80 hours and you just did it, and everybody did it the same way, right? And I think I kept chasing somebody else's definition of success and not really thinking that that is not what I wanted. And I think that's why I was a little bit, it was hard for me. It was hard to find my groove. It was hard to find how I wanted to practice, the place I wanted to practice. And it took a few years for me to figure that out. Um, I would say mostly because I'm very stubborn and I was able to, I was like, I'm not quitting. I'm doing this because it's what I want to do. And so, but I can see how this would be something that burns women out and doctors in general. But of course, I have a lot more information accessible to me through the women that I help with. But it is something like chasing that idea of what everybody else's success looks like. And social media is beneficial for a lot of things, but it's also very detrimental to some of that imposter syndrome, right? And thinking that, oh, look at that doctor. She, she's doing X, Y, and Z and is so successful. I should probably do it that way. But if it doesn't speak to you, if it's not you, your patients won't notice and your business will notice and your business will be a reflection of a lot of that. So I think that was really hard for me at the beginning, mostly not knowing who to go to for that. I didn't really have some big mentors graduating off the bat. And so I had to go and be in different rooms and find certain people, which led me to a lot of the places I am now, and meeting people like yourself in multiple different spaces and some other big leaders in the community. But I didn't have that on the beginning and I didn't know where to look for it either, because in my brain, I was just a brand new doc and, there wasn't anything special about me. And so that is something that I struggle with quite a bit at the beginning. Um, and finding that right mentorship and understanding that no two doctors are alike, even if we take care of the same population and the same people, you have to find what type of practice fits you well and who do you want to serve too, because I think that also adds a lot of value to how you practice and the longevity of your practice too. Um, and so, yeah, so that was a big, big challenge for me.
So, as the current president of Women Chiropractors Organization, what are the biggest priorities that y'all are focused on right now?
You asked that. We have a couple new initiatives coming up. We've been mostly focused on serving the practicing women, but we are expanding into the students because one of our big visions and goals is to make sure that the amount of students, the percentage of women students in chiropractic colleges reflects the number of women in practice, like actually in serving people and actually in practice. And we know that's not accurate right now. It's about 50-50 in schools, and it is not 50-50 in practice. And there's a number of reasons for that. We obviously don't have enough data to know if there is a reentry period later on, and that may be a great thing to add to a survey later on. But we know that it's not translating, and a lot of women are stepping out of practice to do something else because it fits better their lifestyle. So Women Chiropractors is now trying to target the students in the last year of graduation and throughout chiropractic school to give them the mentorship and setting them up for success, whether it's financially with scholarships and grants, whether it's with mentorship programs, with free classes and opportunities where they can meet the leaders in the profession and they can have access to these systems so that when they graduate, they have a better plan, they have better options, and hopefully that turns into better outcomes 5, 10, 15 years out. So that has been a big goal of us in 2026. It's one of our biggest missions and touch points. And of course, continuing to support women in all aspects of the profession, from early doctors to the ones switching and retiring and coming back and giving back to the profession as well.
So, while we're on that topic, if there are lady docs that are listening to this and they think, "Oh, wow, I didn't even know that was out there or that was available," what's the best way to contact you
Yes,
or
our
to contact your
website
organization?
is, of
I don't
course.
imagine you want all this stuff coming into your clinic.
Yeah, no, right. The more the merrier. I'll go home and they can work, they can be here. But our website for the organization is www.womenchiropractors.org. We are a nonprofit organization, and that allows us to do a lot of different mentorships and grants and scholarships. We are on social media as Women Chiropractors as well. We do have a Facebook group, which is what we're most commonly known, but we do in person events. We have a big community outside of our Facebook group and membership options that allow women to have access to discounts and different services and private mentorship, one-on-one programs, and as well as a whole library of documents, courses on things like Medicare billing and documentation and ethics. And so there's a lot of access available for a minimal donation to our organization.
Awesome. So, what advice would you give to other women in healthcare trying to pursue leadership roles while raising a family? Because I mean, it's hard enough to do that anyway. But as a mom, I can't imagine the challenges that are around that.
Yes, and it has been quite a journey the last 16 months to figure it all out, and bring my son along. Honestly, we do it honestly and we do it raw, and it's a little messy sometimes, but I think there's such a value in exposing your children to this. And like you said, you were exposed to this culture and the not just the hustle, but the lifestyle since early on. And obviously that has had an impact on your life. And I'm sure there's many stories like that out there of kids. And I honestly it's about showing him that's what I think about every time I make a decision on business, on how am I supporting an organization, what we're doing next with our community. It's really thinking about showing him that these opportunities are there and that you got to find something that you're passionate about and that you believe in and going forward with it, right? And I try to include him in everything, and I don't know if he has any idea what we're doing or not, but having them around and exposing him is the best thing I can do for him to hopefully raise a human that is kind and gentle and wants to do more for others too.
Yeah, I think that is so important. And looking back on my mom's career and my stepdad as well, my first Parker event must have been in 1967. And I didn't know what we're doing. My parents were going to a convention. I jokingly tell people I had a drug problem as a child. They drugged me to this event. They drugged me to that event. They drugged me to this event. I mean, they usually took me with them. And you don't realize I mean, those are really the formative years of your child's life. And um, while you may have aspirations for what you want them to do, they may be different, for the child when they get big. But having that background, having that experience early on, I think will mean a lot to them at some point.
I hope so too. And on
So,
the mother side, I think it's important too for our society and our not just in chiropractic, but in healthcare in general, to have women try to be more involved. Women are the decision makers in the household, and I think they bring a lot of insight and
yeah.
value to leadership. And so it is important, I think, to have them in academia and in leadership positions to change the culture of what healthcare should look like in the future for our kids.
So we're going to wrap this up with a couple of fun questions. Who's your hero and why?
My dad, he just his work
That
ethic
didn't
and
take
his
long.
compassion. Pardon?
I said that didn't take long to come up
No,
with.
it was the first name that came to my mind. I mean, in chiropractic, there's a few names, right? And but the first thing that came to my mind was my dad. Just thinking about, what we've been talking about. I was like, oh yeah, that's
As it should be. So what talent do you have that most people don't know about?
from Puerto Rico. I'm fluent in Spanish, but I'm a spelling bee champ.
Really?
Yeah.
How about that?
Yeah. I did a lot of the spelling bee competitions when I was young.
Awesome. So what's the worst job you ever had?
Oh, cleaning. I was in the concession stand. I worked at the movie theater and cleaning popcorn machines. It is the absolute worst thing in the world.
I never would have thought that.
It's awful. It's do not recommend.
Oh, all right, we're going to wrap it up here. So, doctors, if you're offering discounts, make sure you're not violating state or federal rules on dual fee schedules, inducements, or anti kickback laws. The fines are serious. Our profitable discount strategy keeps your discounts fully compliant and profitable. It starts with the free, no obligation call to see if we can help you, just like we've helped thousands of other doctors nationwide. Many have seen a 20% increase in revenue and a 50% patient retention within our network. For 18 years, over 7,000 chiropractors have helped 4.3 million patient family members get affordable care through ChiroHealth USA. If you want more revenue, better retention, and peace of mind, call 888-719-9990 or visit CHUSA.com. That's CHUSA.com to see why ChiroHealth USA is the network that works for chiropractic and you. Make it a great day, everyone, and thanks so much.